Hi, good evening everyone. I am Blessy. I am one of the OET IELTS trainers with Dynamic Academy. Hope you all are fine and safe. I believe that my audio is audible and my voice is clear to everyone. And up to the week, we are back again with a different discussion topic, that is OET speaking subtest. So before that, let me give a brief introduction about OET. As you know that OET is an occupational English test. In that test, they are going to assess your language skills or your ability in English language, and it's especially for medical professionals. And in this test, they are going to check the four skills like listening, reading, writing, and speaking. And speaking will be the fourth subtest that you are going to face in the OET examination. So today's discussion, we have taken speaking module. In that we'll be discussing the test format, how the OET speaking is going to be assessed, and first the overview of the test. Speaking subtest takes approximately 20 minutes and it is profession specific, where the candidate is required to complete 2 role plays based on the typical workplace situation. So here you will be having a warm-up section also before your 2 role plays. Your warm-up section will be the first part in your speaking subtest, and it is not going to be assessed. In this test, they are aiming to make you comfort, and you can make a rapport between you and your interviewer. Here, this warm-up conversation, interviewer will be explaining the format of the test, and he or she will be asking some question related to your professional, like professional interest, your previous experiences, and your future plan. Then you will be taken to role play section. 2 role plays will be there. So 2 role plays will be having the same procedure only. You will be getting a role play card, and you are supposed to read this role play card for 3 minutes. That means the preparation time for your role play is 3 minutes. And after 3 minutes, you will be asked to start the role play, and role play is recorded and it is for 5 minutes. In between, you have any doubts or concerns or anything related to this role play you want to ask, you can ask to your interlocutor during the preparation time. Then how OET speaking is assessed. I've already mentioned your whole speaking subtest is recorded, and it is the audio recording that is going to be assessed. And your speaking will be assessed by minimum 2 OET assessors, and neither of the assessors will know the score that has given to you or what scores you have got for other subtests. And your test day interlocutor plays no role in your assessment. He is just helping you in the role play only in that particular speaking test. He or she doesn't have any right, or he or she is not going to evaluate your speaking. And these OET assessors target only the particular criteria what is framed by OET to judge your speaking or your ability in spoken English. So we can move on to the criteria, which are criteria that are used to assess your speaking ability. The criteria, there are total 9 criteria, and these criteria are divided into 2, mainly linguistic criteria and clinical communication criteria. So from the word linguistic, it is clear that it is based on language. So linguistic criteria under this four criterions are there. First is intelligibility, then fluency, appropriateness of language, resources of grammar and expression. And these four criteria have given a scoring from 0 to 6. Based on that only, you are getting a score out of 500, and based on that, you will be getting a grade. So first criteria which comes under linguistic criteria is intelligibility. In intelligibility, they are going to assess whether your examiner or the second person who is sitting in front of you can understand what you're saying. This intelligibility doesn't have any connection with intelligence or knowledge. It is purely based on pronunciation, your intonation, stress, and rhythm. Also, pitch is also considered. So here, you can see your voice should be very clear, and you have to speak in a natural speed. That is very, very important. If your speech is too slow, means your listener will get frustrated while waiting for you to finish, or it may lose that the flow of the particular argument or the information. Similarly, if the speed is fast, it might be difficult for the listener to comprehend. So make sure that you're speaking at a natural speed. Then pronounce words correctly. That is also important. And pauses are allowed, but don't take long pauses or unnecessary fillers. Second one will be the fluency. They're going to assess whether your speech is smooth or not. And do not pause for a long time, and avoid the use of fillers. Like if you are not getting any words or information to proceed further, you will be adding simply and, but, like that, linking words as you are adding. So avoid the excessive use. I'm not asking to not use these things. You can use, but avoid the excessive use of it. That is our second criteria with criterion which comes under language criteria. Our third criterion is appropriateness of language. Here it includes you have to use a suitable professional language, and they're going to check whether you are able to explain in simple terms as necessary and appropriately the given scenarios or the technical terms or the medical terms. So they are going to assess whether you can explain in detail or in simple terms, because your interviewer or your interlocutor will be acting as a patient or patient's relative perhaps. So you have to use a common language since they are common persons only. So they won't understand many of the medical terminology. So it is very important that you will be explaining each and every terminologies as simple as possible. Then the fourth criterion is resources of grammar and expression. Here they are going to assess the range of vocabulary, that whether you can use high vocabulary words, or whether you are able to paraphrase or not. Paraphrasing means you can add synonyms, okay, high vocabulary words, and they are going to check whether you are forming questions correctly, or if you are conveying the information using articles and prepositions. You know what is articles? Articles are a and the. Okay, it has to be used in the correct positions, and prepositions like in, on, at, with, by. Okay, they also should be used accurately. Okay, these are the four criterion they are going to check in your language criteria, and it has given a score from 0 to 6. Then we move to the next criteria, that is clinical communication criteria. You can see under clinical communication criteria, there are 5 criterions, and it has given a score from 0 to 3. The first criteria is indicators of relationship building. Then comes indicators of understanding and incorporating the patient's perspective. Then indicators of providing structure, indicators of information gathering and information giving. So we are going in detail with each of the criteria. First one, it is indicators of relationship building. So first you have to initiate the interaction appropriately. You have to greet your patient in a friendly manner. You have to be confident because you are a medical professional, and you have to welcome them appropriately. For that, we can use words such as good morning, good evening, good afternoon, according to the scenario which is given in your role play card, or according to the examination time, you can use appropriate greeting. That is very, very important. Then you have to demonstrate that you are respecting this patient. Okay, don't be judgmental. Okay, always whenever you are talking, whenever you are giving information, give in a right tone that it shows that you are respecting the patient and you are non-judgmental. And empathize with your patient. So there is a difference between empathy and sympathy. As a medical professional, you know what is empathy. So you have to show that empathy. You have to consider that situation, the similar situation is happening with you. You have to accept that the exact situation what the patient is going through is happening with you, and you have to consider the situation, and you have to accept and show the empathy. Then comes the second one in this clinical communication criteria, that is understanding and incorporating the patient's perspective. So here two things are there. One is understanding the patient's perspective. Patient's perspective means it can be the view of the patient, the idea of the patient. Then next thing you have to incorporate. Okay, two things are there. One is understanding and next one is incorporating. That means you have to include what are the perspectives or the ideas you have collected from the patient in your information. You can frame questions such that you can obtain the ideas or concerns or expectations from the patient side. So you can elicit and explore the patient's ideas, their concerns, their expectations, and you can add that in your information also. Then the third thing is good to do a repeat back. That is also an important factor here. That means what all ideas you have taken, or what are the concerns what this patient have told to you, that concern you can incorporate when you're giving information, and you can it's better to do a repeat back. Okay, that not if they have said you some information, you can again take that information what they have said, and you can ask, is that right or is it right? Okay, like that you can do the repeat back. That is also important for this criteria. Next comes providing structure. Providing structure means you have to sequence the whole role play, because your role play or your speaking is going to be assessed, not your interview. So make sure that you're following correct organization. You have to initiate your role play when the interlocutor will ask you to start the role play. You have to initiate it. Then you have to greet the patient. You have to introduce yourself. Then you have to come to the task one by one and have to conclude it correctly. That is providing a structure. In this, one more thing is that signposting. Signposting means when you are moving from one task to another, you can inform the patient that we are going to next task or another topic. Okay, that is called signposting. Then next one is fifth one is information giving. So here you have to provide information, or you have to give explanation to whatever the patient is asking, what their concern is. This will make them understand more about their current condition. Also, this will make them comfort also. Okay? While giving information, you can reassure, you can give information which comfort the patient, and also you can use empathy. You can show the empathy also here. And last one, that was our last one, information giving, and always try to know that whether the patient needs any further information. Okay, that is very, very important. Whenever you are giving some information, you have to ask whether they are understanding it, or you can ask, do you understand, or are you following me, or do you want me to explain it again? Like that, you can make sure that the person, the patient or patient relative is understanding what all information you have given. Okay, these are the 9 criteria. Based on this, your speaking is going to be assessed. So this is very, very important. Go through these 9 criteria and be thorough with this and speak it. Okay, according to the scenario, according to the task, and consider these criteria and speak. Then you will be getting a desired score for your destination country. Okay, so practice it. Practice speaking. Without practicing, you can't improve your speaking skill. Okay, so if someone is practicing, means their speaking skill is improved. If you practice, your speaking skill will be improved. So it is very, very important. Practice, practice, practice. Okay, that is the most important word that that will be used here. Apart from other tips and tricks, the most important thing is practice. You know that practice makes a man perfect. So hope you have enjoyed this session. You have understood, you have got an idea about not everything. I have given only a brief description. And if you need more explanation, you can message below this video, and we will be considering your concern, your doubts in your next live section. Thank you so much for listening, and be safe. Wish you all the best. Good evening. This is a sample recording for OET speaking. This test is held on June 11th, 2021, Friday. The candidate name is Ms. 𝗤𝗚𝗄 and the interlocutor is Ms. Blessy. Shall we begin?
Yes.
Good evening. My name is Ms. Blessy. Can you state your full name, please?
I am 𝗤𝗚𝗄.
Okay. So you are taking a test for nursing, am I right?
Yes.
Okay, so I'm going to working with you in this test, and there will be a warm-up session and followed by a role play. Remember, this is a test for English, not for your knowledge, so speak naturally. So shall we move on to warm-up questions?
Yeah, sure.
Okay, and it is not assessed. Why did you decide to become a nurse?
Yeah, since my childhood, I always had a passion towards serving people, and I could feel that this is a very good profession to serve others. And also, one of my cousins were a nurse, and she inspired me a lot to become a nurse. That's why I chose nursing. Yeah.
Okay, perfect. So, which country are you planning to migrate?
Yeah, I'm planning to migrate to UK.
Okay, that's perfect. Then your last question in your warm-up session is, what advice you can give to your juniors?
Nursing is a very noble profession, and here it's a science and it's a profession. So we need to keep updating our own knowledge, and it needs both knowledge, skill, and attitude also. And we need to have passion towards caring people also. So this is my advice to new nerds.
Okay, fine. Thank you. And card, you can take 3 minutes to prepare. And I will be taking the part of patient, perhaps relative, and you can take the role of the professional. And you will be starting the role play after this 3 minutes of preparation, and your role play will be recorded for 5 minutes. And when I stop you after this time, don't get worried, and you can make notes if necessary. And if you have any concerns or doubts regarding this role play, you can ask me during the preparation time. So now your time starts for preparing. Okay, your time is up. Next 5 minutes, your role play will be recorded, and you can start.
Hello, I'm 𝗕𝗟𝗃. I am your attending nurse on duty today. I see that you rang the nurse call button. How may I address you?
Call me Miss Blessy.
Okay, Miss Blessy, you seem angry. Would you mind telling me what's bothering you?
Finally, someone is asking that. I rang the buzzer 30 minutes ago. Where were you?
Oh, I apologize for the delay. I had to attend to a critical patient urgently. How are you feeling?
I think no one seems to care. I'm in a lot of pain, but this is a ridiculous hospital.
I can sense that you are quite upset. Could you please elaborate on what happened?
Well, I'm not just upset. I'm distraught and angry and in a lot of pain. And this is so horrible that no one has ever treated me like this.
I'm so sorry to hear that. I apologize for the rough experience that you have had. Please let me know how I can assist you.
If you have cared, you would have been here earlier. Your story is not good enough, so I'm going to file a complaint against you and everyone here.
I can see you are incredibly upset, Mrs. Blessy. It's important that we understand each other completely. Would you mind telling me what's bothering you?
Yes, of course. I rang the buzzer 30 minutes ago, And I have been sitting here and waiting for someone to give me some medication to help me with my pain, but no one cares in this hospital and you all are useless.
Thank you so much for sharing this with me. It helped me to understand the situation much better. I can now understand how frustrating it must have been to wait while you are in pain. I'm sorry for this. I will ensure that it does not get repeated.
Yes, that's fine. I need to get some tablets now. This pain is killing me.
Certainly. But before that, would you mind telling me how severe the pain is on a scale of 0 to 10, where 0 is no pain and 10 being the worst you have ever experienced?
It's like an 11.
I'm so sorry that your pain level is so high. Did the pain medication we gave you earlier help at all in alleviating the pain?
No, it's really not helping. I need something stronger.
Right. So here what I'm going to do. I'm going to call the doctor and let him know that the pain medication you are on is not helping to control your pain and you are in a lot of pain right now. I need to ask him if we can give you something stronger. If he is comfortable with that, does that sound good?
Wow, that's another delaying tactic you have there. Just give me some strong painkiller. It's all I'm asking.
I know it's very difficult to cope with the pain. However, I am only allowed to give medication as prescribed by the physician. It's beyond my scope to change the medication without doctor's order. Your safety is my priority, and it is critical that the doctor agrees to switch your medication. That being said, I'll ensure that you do not have to wait long. Is that all right?
In that case, where is the doctor? Shouldn't he be there here? I would like to see him as soon as possible.
I understand your concern, and where are you coming from? It's early morning, so he's probably on a round and should be coming to see you soon.
But I'm in a pain. What could be more important to him than this?
I know that it's distressing to be in this situation. Here is what I recommend. Let's call him first and form a plan of action to manage your pain. I will also ask him to visit you as early as possible. Would that be okay?
Yes, I would like something to help with this pain because my husband just left and I'm alone. On top of that, this pain is making me so uncomfortable. I need to feel better.
I can understand. That does make sense. I can see why you have been upset. It's hard enough to be in the hospital, let alone with other stuff going on.
Yes, yes, of course. And I don't know for how long I will have to stay here.
Besides managing your pain, is there anything else too that I can assist with? I want to ensure that you are properly looked after.
Yes, sister, I have one more concern. I don't like the hospital food at all.
Thanks for sharing this with me, Miss Blessy. Regarding the food, I can request the hospital dietitian to visit you shortly to discuss your food preferences, after which she can customize your diet plan to meet your needs. How do you feel about what I'm proposing?
Yeah, yes, that's fine.
Okay, here is what I'm going to do next. I'm going to call the doctor regarding your medication, and following that, since you do not have any family here, I will check on you at least once in every hour to ensure that you have everything you need. I will also notify the dietitian to visit you soon. Does that sound okay?
Yes, of course, that sounds like a good plan.
Okay, I'll be back soon with your medication.
All right, thank you, nurse.
You are welcome.
Okay, that's the end of our role play. Thank you. Hope you all enjoyed our section. If you have any queries or concerns, please message below this video. We'll be taking your concerns in our next live section. Thank you. Take care, everyone. Good evening once again. My name is Blessy. I'm from Dynamic Academy. I believe that you got an idea about OET speaking subtest, its test format, how the role play is conducted, and how it is assessed. So now I'm going to give a description about a particular role play that we have done today, and the candidate role play card is displayed here. You can see this role play card is divided into 3 sections, and here first will be the setting. In which setting this role play is going to be conducted. Here it is, hospital ward. Then comes the background information. So you can see here, you have been called to the patient's bedside. The patient is a 37-year-old man or woman who was admitted to the hospital yesterday with a fractured leg. You notice that he or she looks quite agitated. It's early morning and the doctor is on rounds in the hospital. He or she was given a painkiller earlier today. So by the help of this background information, you can begin the role play. Here, you have to play, the candidate has to play the role of a nurse, and your interlocutor will be playing the role of the patient. So when you begin a role play, you have to begin it with a greeting, either good morning, good afternoon, or good evening. So here it is given the particular time the role play is happening, that is early morning. So you can start the conversation or the role play with a good morning. And based on the background information, you can give the introduction. That is the next step. So here, candidate has to start an introduction with a polite, they have to give a polite introduction. Politely, they have to introduce themselves and investigate the reason for being called to the patient's bedside. So there are different ways that you can frame questions, and I'm giving some examples now. You can start like, good morning, my name is, you can give your name. I am going to be taking care of you today. I see that you rang the buzzer. Or you can say like this, good morning, my name is so and so. I am the attending nurse on duty today. I see that you rang the nurse call button. Please let me know how I may assist you. After that, you have to ask, candidate should ask the patient what or he or she would prefer to be called. Sometimes some people are prefer to be called by their first name, or some are preferred to be called by last name. Some need to add their titles like Mr., Mrs. or Miss. So you can ask, how may I address you and what do you prefer to be called? Okay, either of these questions you can ask. Then we can, after this introduction, you can go to the role play, your task. You can see the first task is given, find out why the patient is angry. So that is the first task. So you have to find out why the patient is so agitated. So here, to find out that, you can ask open-ended, indirect questions to find out the cause that has triggered this reaction of the patient. So you can ask like this, you seem angry, would you mind telling me what is bothering you? Or you can ask, I can see that you seem angry, would you please tell me what's troubling you? So here, the student, the candidate should exercise a reflective listening skill to acknowledge or validate the patient's concerns, to demonstrate an understanding of the situation. So this can be done by repeating or paraphrasing or doing a repeat back or reflecting back what the patient responds. This reflective listening skill will not only affirm that the patient is being heard, but also provide more opportunity to the patient to express himself or herself. So you can say, if I understand you correctly, you are angry about the delayed bedside visit. Is that right? This is the way of doing repeat back. Then you can go to the second task, that is, explain that you were attending to a critical patient. Once it has been established that the patient is upset regarding the delayed bedside visit, the candidate should explain the reason for the delay. However, here you have to be very much careful while you are explaining it. You have to explain it using empathy. So empathetically, you have to frame some sentences to explain why you are late. So use polite expressions to justify your reasons, like, I apologize for the delay. I had to attend to a critical patient urgently. Or you can say like this, I'm so sorry that you had to wait for so long. The reason my visit was delayed is that I was attending to a patient in critical condition. Like that, you can explain the second task. Then comes the third one. Empathize with the patient regarding his or her complaints and calm the patient down. Okay, two things are there. One is empathize with the patient regarding his or her complaint, and then you have to calm the patient down. So both have to do it. For this part, also candidate has to respond empathetically to the patient's complaint to validate his or her feelings and show understanding. Then here also candidate can also use back channeling when the patient is expressing his or her complaint to make him or her feel that you are hearing or you are with them. Like you can utterance some words like okay, right, like. But the student needs to demonstrate an awareness of intonation and timing while using this. And it is also important to include expressions of apology to diffuse the patient's anger or at least prevent him or her from becoming more angry. So here a candidate should adjust the style of communication when talking to an agitated patient. That means it should be in a calm tone. You have to speak slowly and clearly. Also, the candidate should continue to ask what he or she can do for the patient. This shows again that the health professional cares enough about the situation and wants to help to rectify it. So you can ask, I'm so sorry that this is happening to you. I understand this must have been very difficult for you. Or you can ask, given everything that you have told me, it's understandable that you feel this way. What can I do to help you? So like that, you can handle the third task. Then come to the fourth one. Ask him or her about the pain, and it is given in the bracket about you have to ask what is the score of pain, then whether ongoing pain relief medication is effective or not. So when the patient has calmed down and he or she demands a pain relief medication for the pain management, so the professional will need to use suitable expressions for pain assessment. Since pain is a subjective experience and may not be clearly articulated by many, a pain scale may be used to encourage the patient to self-report the intensity or severity of the pain. So you can ask like this, would you mind telling me how severe the pain is on scale of 0 to 10? That 0 is no pain and 10 being the worst you have ever experienced. Then the student should use the polite expressions to inquire about the efficacy of the pain relief medication given earlier. So you can ask like this: I'm sorry that your pain level is so high. Did the pain medication we have given you earlier help at all in alleviating the? So like that you can handle the fourth task. Then you can go for the next one, that is explain that you need to call the doctor to change his or her pain relief medication. So for this particular task, student would need to explain that a stronger medication can only be administered with a physician's order. It needs to be done skillfully as the patient is in pain and has already had to wait for 30 minutes. Therefore, the nurse should justify this step by explaining that this decision is the patient's best interest. It can also be explained that prescribing a new medication is beyond nurse's limit of competence. And the candidate can also provide emotional reassurance to the patient by ensuring that the patient will not have to wait long. At the same time, you have to use empathetic phrases, should be to acknowledge patient. So you can see like this. So here is what I'm going to do. I'm going to call the doctor and let him know that the medication you are on is not helping to control your pain, and you are in a lot of pain right now. So I need to ask him if we can give you something stronger, if he is comfortable with that. That's something. So like that you can ask or give an opinion and ask. In this case, if the patient demands to see a doctor, students should calmly explain he or she is on grounds and to offer the doctor for managing patient's pain. Okay, that is given. Explain that you need to call the doctor to change his or her pain relief medication. If the patient is asking whether they have to see the doctor by themselves, so you have to say that the patient, sorry, the doctor is on ground. So, and we will give some chance to meet him. At the same time, it should be recognized that the situation is difficult for the patient to cope up with. Also, we have to reassure the patient by conveying that the doctor is concerned about patient's welfare and should be seeing the patient as early as possible. So we can ask, or okay, you can say like this: I understand your concern and where you are coming from and what the exact condition. It is early morning, so he's probably on rounds and should be coming to see you too. Would that be okay? So it is important that we have to check the views or whether the patient is okay with this decision, what we are saying. So you can ask the questions like, how does that sound, or is that okay with you? So it is very important to adopt a non-judgmental approach towards the patient's perspective and knowledge that legitimacy of the patient to have his or her own view. Then we'll go to the sixth task, that is find out if the patient has any other concern. So if the patient expresses some dissatisfaction while being in the hospital, some probing questions may be asked to find out if there is anything else bothering the patient. You can ask like this: besides this, is there anything else bothering you? Or apart from this, is there anything else that I can assist you with? So after that, in the next step, you would pick up some verbal cues and acknowledge their concerns by using emphatic phrases that signal sensitivity to their predicament. Like that, that does make sense. I can see why you have been absurd. It's hard enough to be in the hospital, let alone with other stuff going on. So you have to consider their situation. You have to show the empathy. Okay, that is very important. And we'll go to the last task, that is encourage the patient to discuss his or her dietary preferences with the hospital dietitian. So when you ask about the concerns that fix the task, they might be saying that they are not liking the food that the hospital is providing. So you can discuss his or her dietary preferences with the hospital dietitian. You can give an assurance that you will be going to talk to the dietitian about the patient's dietary preference. So here the candidate should attempt to arrive at a favorable outcome for the patient by suggesting that he or she discusses food preferences with the hospital dietitian. So after that, you have to conclude this role play by collaborating with the patient to arrive at an acceptable plan. Like what I'm going to do next is I'm going to call the doctor regarding your medication. Following that, since you don't have any family here, I will check on you at least once in every year, every hour to ensure that you have everything you need. Then I will also notify the dietitian to visit you soon. Is that all right? Okay. So after this role play, you have completed all the tasks. After that, you can end it correctly. You can ask whether they have any other concerns, or you can ask, do you want me to explain anything else again? And you can conclude the role play. Okay, like that, you can give an assurance what all things you are going to do. You are going to call the doctor for the pain medication. Then you are going to talk with the dietitian about the patient's dietary preference. So hope you understood how to do a role play. And when you get 3 minutes to prepare, you can prepare like this. Okay? You can take each and every task and you can prepare what exactly you want to ask, what all information you have to. And based on the criteria only, they are going to assess your speaking. So it is very, very important that you have to keep in mind always the 9 criteria. If you have any further queries or concerns, you can just type the message below this video. So we'll be taking care of your concerns in the next live session. Hope you have enjoyed, and be safe and stay blessed, everyone. Thank you so much.